So, coming to the section with clinical features, if a patient comes up to the outpatient department and presents with some very specific symptoms, how are you going to suspect that a patient has diabetes mellitus? So, we'll be talking about those clinical features in detail. The more foremost clinical symptoms that a patient might present with, whether the patient has type 1 diabetes mellitus or type 2 diabetes mellitus. So, those symptoms include polyuria, which is an excessive and frequent urination. The patient might complain that he has to wake up in the middle of the night to go and use the washroom, and he has to use the washroom to urinate throughout the day. So, this would be a very, very striking feature. The patient might also present with polydipsia, which is that the patient might complain that he has to drink water a lot throughout the day. Even though if it's summer or it's winters, he complains that he feels very thirsty throughout the day, regardless of having a lot of water intake. And this has very low specificity, but the patient might also complain that he has polyphagia, which in other words is that he has excessive hunger, and he has the temptation of eating a lot of food. So now if we talk about the clinical symptoms and signs specific to type 1 diabetes mellitus. So this would include fatigue, patient feeling very, very tired throughout the day without any obvious reason. Malaise, which is also similar, having to rest in the bed all day, having not to work. Nausea, vomiting is very, very low, but this could also be one of the reasons why a patient might present with type 1 diabetes mellitus. Patient might also have some psychological irritability and could also be because of some stress. The patient ultimately also comes up with the sign and symptom that he has lost a lot of weight, which is very specific to type 1 diabetes mellitus. As you all know, that type 2 is because of obesity, and the patient might have weight gain instead of weight loss. So, in type 1, weight loss is the specific feature. And the patient might also present with abdominal pain, which is usually off and on but not very specific. And the patient might present with all these gastrointestinal signs and symptoms, which could be nausea, vomiting, and diarrhea. Now, coming to the signs and symptoms of ketoacidosis. Diabetic ketoacidosis is one of the complications of diabetes, whether it's diabetes type 1 or diabetes type 2, and it's a very dangerous sort of acute complication regarding diabetes. So we'll be talking about the clinical features. If a patient comes into the emergency department, so how are you going to diagnose this patient that he has diabetic ketoacidosis and he's going into the complication? So the patient might present with a very dull sort of a symptom that he has very dry skin, which is specifically has a term called ketoacidotic dry skin. The patient might present with decreased skin turgor. As you all know that a patient with diabetes ketoacidosis, they usually present with dehydration. So as the patient is having dehydration, the skin turgor would be very, very decreased. When the doctor pinches the skin usually feels very dry and the turgor is very, very decreased. The patient might present with tachycardia, one of the symptoms of an emergency, which is increased pulse rate. Patient might also present with tachypnea, which is increased respiratory rate, and that is the reason why the patient would be in dehydration and have increased breathing rate. Labored respiration, as you all know, labored respiration would be that the patient is having a lot of stress and is having a lot of difficulty in breathing. It's not very specific to any respiratory problem, but it is because of diabetic ketoacidosis. The patient might have a very specific fruity breath, and this is very specific to diabetic ketoacidosis. The patient might have abdominal pain, which is very specific towards the lower abdomen, and the patient might also present with confusion. So these are the list of symptoms that should strike foremostly if a patient comes up into the emergency department. Regardless, the patient can't give his history of having diabetes mellitus, but these are the specific symptoms that a patient should be presenting with, and then ultimately you'd be doing his BSR, checking his sugar, and ultimately you'd see that the patient has hyperglycemia. So if we talk about the second type of diabetes mellitus and its specific sign and symptoms, one being fatigue, which is also common in type 1 diabetes mellitus, the patient might feel very tired and have a lot of malaise. The same symptom psychologically, the patient might feel very irritable. The patient might also present with drowsiness. He could feel confused and could feel very sleepy and feel drowsy in a sense. Blurred vision is also one of the complications of type 2 diabetes mellitus. Numbness and tingling is very specific to diabetes. As you all know that it affects the neurons. Ultimately, diabetes can affect the peripheral neurons, and the patient might present with numbness and tingling of fingers, hands, and feet. Slow wound healing is also one of the specific reasons why a patient might complain with slow wound healing, having type 2 diabetes mellitus. And lastly, frequent infection. This could be any upper respiratory tract infection, any urinary tract infection. So this can also strike the doctor that the patient is having any diabetes like disorder. So these are all the signs and symptoms of diabetes mellitus, specifically type 1, type 2, and diabetic ketoacidosis, which is the complication of diabetes.